Thank you everyone for joining us this evening. We have this time on the board agenda, and we will continue to do so at each board meeting, providing an update regarding what our transition planning is for fall of the 2020-21 school year and beyond. Next slide, please, Michael. On the agenda this evening, we're going to highlight some of the planning assumptions that our small planning teams are using, and also the charts that they have been given. And they will give a brief, those facilitators are planning to give brief updates on some of our immediate next steps. Next slide, Michael. However, what's not on this evening's agenda are our considerations for the closing out this school year and also the summer, because we have shared that information out with our families and staff previously. But if you have any questions at the end of the presentation, I'm more than happy to answer those. Next slide, Michael. All right, so in terms of responding to the challenges of COVID-19, I think everyone across the country is recognizing that this COVID-19 coronavirus has really shone a bright light on the inequities in our country, from healthcare to employment, and also what we see in education. Students have barriers to access to high quality learning experiences, to support of their basic needs, and also even with the trauma producing anxiety and stress that we're seeing for some of our families, we also see some barriers to providing mental health. However, in District 97, I do want to point out, if we can go to the next slide, Michael. And I may be behind, but are we at the next slide, food delivery? All right, thank you. In District 97, we have served, since the time that we've been out, March 16th through as of May 11th, a total of 32,550 meals. As well, if you can go to the next slide, Michael. We've provided students access to high quality learning experiences by making sure that every student in our district has a computing device at home along with internet access. We've provided students access to our staff via face-to-face daily interactions. And in terms of support, we know it will be really difficult for our staff to do the work that they've done without providing the supporting conditions to them. Next slide, Michael. In terms of the staff professional learning, since we have been closed due to COVID-19, we have held 5 remote learning planning days. And over 543 of our staff members have been engaged in a variety of professional learning opportunities. Next slide, Michael. A sampling of these sessions include middle school planning resource reviews for the SY21 school year. We've had our partners such as Lisa Westman and Meg Ormston also helping with our staff with planning for meaningful instruction. Next slide, Michael. We've also attempted to keep the community engaged around what we were working on. We've set up a COVID-19 remote learning update on the district's website. We've held virtual parent meetings with school staff and principals. Our district administrators have held the virtual Q&A. And we've had other opportunities to target the outreach, listen to, and connect with our families around their experiences. Next slide, Michael. I really want to give a huge thank you once again to Jeannie Keene and her entire staff with the Buildings and Grounds, because this staff has been, as well as our food services delivery and technology, they have been a part of our essential operations, remaining on our front lines and keeping our schools clean, sanitized, and well-maintained during the closure, as well as helping to secure disinfected paper goods, soap, PPE equipment as we begin to prepare for the upcoming school year. So huge thank you. Next slide, Michael. Huge thank you to our entire team. So now moving on, next slide. I've had the opportunity at each of the remote learning planning days to welcome the staff virtually. And I've been using this poem. I don't know if it's a poem or just a quote, and I've actually been reading aloud because, you know, as much as there have been a lot of heartache with coronavirus across the world, I think not only in our country, but in our district, we can take this as an opportunity for us, an opportunity to use this predicament to be both productive and purposeful with stitching a new garment. So if you give me a little liberty here, we will not go back to normal. Normal never was. Our pre-corona existence was not normal, other than we normalized greed, inequity, exhaustion, depletion, extraction, disconnection, rage, hoarding, hate, and lack. We should not long to return, my friends. We're being given the opportunity to stitch a new garment, one that fits all of humanity and nature. Next slide, Michael. So as you know, the governor outlined a 5-phase plan to restore Illinois for slowly and safely reopening. There are particular public health metrics that we can all follow, but we need to reach those metrics in order to move from one phase to another. So we're currently, as we know, in phase 2 in this plan. Hopefully not, but we could go backwards or we can continue to move forward. And as you can see on this slide, it shows that it's phase 4 where schools and childcare may reopen, but it's not reopening or not school as usual. And obviously we would also have to follow the guidelines issued by the Illinois Health Department, as well as the Village of Oak Park has its own health department too. So with that, next slide, Michael. We also are centering our work and our planning on the district's vision, which we know is to create positive learning environments for all of our students that's equitable, inclusive, and focused on the whole child. Next slide, Michael. So it's really all about scenario planning. So as we look ahead to the 2020-21 school year, it is really important that we consider the impact that COVID-19 has had on us and will continue to have on our community. Although much remains uncertain, we do know that the eventual transition back to on-site learning will require a great deal of planning and preparation in order to ensure, and this is our #1 priority, the health and the safety of our students, our staff, and our families. However, I have a few things to point out before we move into the assumptions, and also before we move into you hearing from each of the small teams what they are have been working on. Point #1, I really wish we knew where we will be at the end of August when it's time for us to come back. I really can't say where we will be. There's therefore no one set plan that we can count on at this point in time. It's all about being prepared for multiple scenarios or alternatives of what the fall could look like. But in all of the scenarios that we're currently planning, once again, our #1 priority we're putting the health and the safety of our staff, our students, and our families first. Next slide, Michael. As early as March 17th, I personally became really actively involved with several think tank superintendent groups at the national, the state, and the local levels. Probably every Thursday evening, Friday late afternoon, Sunday evenings, I'm on calls or have been on calls where other leaders across the nation are discussing various what ifs. And it was from those early conversations that I shared the following list of assumptions with our core cabinet team and also at leadership. These assumptions came from a variety of sources, including, as I said, the AASA, the CDC, as well as my professional learning networks. And again, as I go through these assumptions, these were drafted and shared with our cabinet and at leadership team prior to Governor Pritzker announcing or sharing his reopening plan. So the assumptions in terms of schools reopening, it was assumed or is assumed that we will not be going back to what we would traditionally think of when schools reopening, and that there would be many things that schools would have to consider: social distancing, screening students, screening staff, to make sure that the staff and students are safe to return. Another assumption that I shared with the administrators was that there would continue to be, and I think we actually saw some of those assumptions come true this evening with a few of our public comments. There would be a broad spectrum of opinions in the community regarding what our response should be. You know, that we should go back or that we shouldn't go back. And that as we move forward, that the decisions would be more local. Next slide, Michael. That there would need to be structural changes to our schedule and calendar to be able to, again, with the assumption of needing to return and implementing social distancing, and also that there would need to be perhaps changes or thoughts around what if we need to periodically close schools, and what would that impact be on families for childcare needs, and what would other challenges be as we think through that assumption. The other challenge is here posed by COVID-19, or at least the assumption is that the duration of this threat will make it more difficult to have unified decisions, meaning that it may not necessarily be a decision on what to do across the entire state, because our state is so diverse, that it might depend on the region or even the individual school districts. Next slide. I think this assumption we have also heard. I share it with the administrators that we should assume that student learning outcomes would be uneven. And let me just clarify this point here. And this point was really intended not because our district's vision does not speak to meeting the needs of all of our students, but primarily due to the public health restrictions or guidance that not necessarily all of our students would be able to be back on site. And if our schools are required to be, the brick and mortar required to be closed, and we are delivering instruction in other ways, that may cause this assumption, and that is potentially an increase in special ed due process filings and demands for compensatory education. And then an assumption being that the staff would need ongoing professional development, collaboration, and support to implement this new model of, quote, school. Next slide. And I know this is really morbid, but at the time that these assumptions were shared with Ad Leadership, again, this was early March, but that we would potentially see staff members who are experiencing either family members or our students that are experiencing family members that are seriously ill or even unfortunately passing away due to the virus. And next slide, Michael. And as a result, or even the result of the uncertainty unknown, that we would see an uptick in the fear, loss, and because of the fear, loss, and isolation, we would see an uptick in the increased need for mental health supports due to the anxiety and trauma. Next slide. And our attendance rates may decline because of students and staff who have either been directly exposed, would need to self-isolate, or those who are ill would need to stay home, as well as those, psychologically that are really not comfortable with returning back on site. And we would definitely perhaps see the need of needing more substitutes as employee absences arise. Next slide, Michael. So with those assumptions in place, I did ask our safety and security teams from across the 10 schools, as well as our safety and security team at the district level to come together to begin to work through various scenarios and logistics. The very first meeting was May 4th, based on that full group, which comprised probably more than 60, 70 staff members representing a wide variety of roles. We did add ad hoc members, and those members formed subcommittees focusing on 5 key areas of our planning. And next slide, Michael. And those areas are safety protocols, operations, district calendar and schedule options, learning models, social emotional wellness supports, and financial impacts. And again, an important part of this process is stakeholder engagement. Since that initial meeting on May 4th, we have included probably about 58 or more ad hoc members to this list of voices that you see in front of you. And we primarily wanted to make sure that we included from across the district those voices who are currently working in our classrooms. We will continue throughout this planning process to seek out the voices of staff, students, and families. And we will keep our District 97 community updated on our progress via our board meetings. So now the next slide, Michael. I want to turn the floor over briefly to each of the facilitator team leaders to share with you really briefly the charge that they've been given, and also some of the briefly some of the next steps that they will be working on. I'm going to start with Gina Herrmann.
Thank you. Good evening. So our team has been given the charge to look at the district calendar and scheduling team as we work through different calendars and such. So one of the calendars that we are looking at is delaying the start of school. You can go to the next slide, Michael. Another thing that we have been given the charge of looking at is identifying different scenarios and how that's going to look in the calendar, and how that will impact our timing of school as well. So Michael, if you can go to the next slide. So this just reviews some of the work we are doing and is telling you what we are going to continue to do. So first and foremost, at the heart of every discussion we have is the physical and social emotional well-being of our students and our staff. And we're also at every step of the way, we're also talking about the challenges with anything we'll meet with, family challenges with daycare or any kind of design that we put forward. So what we are doing is really examining various calendar options, whether it be all students in the building, all students virtual, some students in the building, some students virtual, intermittent virtual, various calendars or various formats, and looking at what the calendar will look like with each of those formats as we move forward. So we look at start date, end dates, when is the best time for Teacher Institute days, when is the best time for parent-teacher conferences, based on all these various models as we move forward. Our priority right now, where we are at, is to really start to gather community feedback. So we've looked at a bunch of different options. We've looked at research, we've looked at what other districts are doing, but now it's time for us to look at what's best for Oak Park. And in order to do that, we want to create a survey for our community, our parents and families. And then we also want to create a survey for our staff. And within this survey, we're hoping this informs our next decisions as we move forward. I'm going to turn it over to Michael Arensdorff, who is really working out the learning models with Eboney Lofton. Michael?
Thanks, Gina. So the learning models, as Gina said, Eboney Lofton and myself are kind of co-leading this group. We've got 6 different subcommittees within the learning models group. And within some of those things that we're looking at the additional supports for students that would be needed, common assessments, looking over the professional learning and what's needed for our staff to provide them the tools and just the learning that they'll need to be delivering different instructional strategies, and whether it's remote or a combination of remote or on-site as well, continuing that plan. Accelerated learning plans. So really projecting out at the end of next school year and what do we want students to know and be able to do and work backwards, and then a data gathering subcommittee. So from that, the learning modules that we're looking at is working closely with the calendar and the safety and security and really all of the groups to identify what would that look like and be flexible with our plan. So looking at the high different learning models and high leverage strategies for instruction, and what would that be for whether it's remote or at home, knowing that, and hopefully it doesn't, as Dr. Kelley said, that we don't move into one phase and then have to go back, but wanting to make sure that we are flexible in building things out that can serve both of those. So some of the models, again, these are just options that we're looking at and planning out scenarios. So one would be a 50%, so having 50% of the students come in and again, variations of what that might look like, and taking in all the different scenarios and things into consideration as we plan through that. Another one would be looking at a 20% model. So per se, you'd look at a class, you have 20 or 25 kids, and you have a fraction of that coming on each day. Again, this is just one option that we're planning through depending on what guidance and things come down. Again, as Dr. Kelley said, whether at the state level or within Oak Park in the health department there. So trying to put all of this together so we can be and mobilize quickly with what these options are. And again, gathering feedback from multiple stakeholders and engaged in that process along the way. And then it could be an option of any of those. And again, it could be the fully virtual, fully on-site, or anything within between. So that's those are some of the things that we're working through. But with that, again, identifying those key strategies and learning models that would be happening, the tools that are needed to support that, whether on-site or off-site, and then also working with our staff to provide them that template and that calendar, so then they can see how those strategies would lay out, and then also what does that look like for students and families, so it's very clear of what a weekly plan would look like for them. So I'm going to turn it over at this time to Eboney to continue moving forward with some of the learning models, things that we're working on.
Thanks,
Eboney?
Michael.
Yep.
Yep, got it. So the learning models team is also tasked with ensuring that we develop strategies to support students who are medically fragile and may also have significant health challenges. So we recognize that while many students have received the special education services outlined in their IEPs, that not all students with disabilities have experienced remote learning equitably. So we also recognize that we need to ensure that we provide additional supports for students with disabilities. And we're working to that end to develop plans of support for students with disabilities that are reflected either in an IEP, a 504 plan, or a medical plan. Next slide. In addition, we also want to make certain that we have a system that allows us to understand exactly how to accelerate learning in the fall by using diagnostic formative assessments and progress monitoring tools. We want to ensure, again, that we're able to support students with disabilities as well as English learners by fully understanding both their strengths and challenges that they present with upon their return. Next slide. The Learning Models team is also tasked with considering and developing a continuum of distance learning options. These include robust independent study programs, instructor-led on-site learning centers that allow for weekly appointments for student support, and synchronous interactive learning using classroom webcasts. You can take the next one. The continuum of distance learning options also includes developing our capacity to provide home and/or hospital instruction to students who are ill, under quarantine, or in self-isolation. We also seek to examine our capacity to use virtual learning centers to provide support during those school closures, should they occur. And last slide. So in terms of what we're thinking about for the next few weeks and also the next few months, in the next few weeks, we're on track to finalize the charge of our subcommittees. As Michael mentioned, we have 6 subcommittees that include data gathering and analysis, our learning models team, accelerated learning plans, common assessments, professional learning, and additional supports. The goal is to then synthesize and analyze feedback from parents, teachers, and students, and to finally flesh out learning plans based on several return to on-site learning scenarios. In the next few months, we also want to make sure that we develop a clear scope and sequence with a focus on acceleration of student learning, that we develop a diagnostic common assessment system that could be administered flexibly, no matter where we are in terms of on-site or virtual, that we deliver the professional learning needed for District 97 staff to continue to ensure that student learning models are reflective of our new normal. And we also want to codify the strategies and supports needed to support students with disabilities, as well as our English learners. And I'm now handing it off to Carrie Kamm to share the work of the social emotional wellness team.
Thank you, Dr. Lofton. So I'm going to share a little bit with you. We've got 4 sub-teams that are really putting together the social, emotional, and wellness guidance for this recovery phase of school year 21. Our first sub-team is working on district social emotional learning guidance document that will include support for the social and emotional needs of students and staff, implementing our social emotional learning curriculum, which is second step in modified in-person settings or remote settings, integrating social emotional competencies with Tier 1 school-wide and classroom expectations, and guidance for creating secure relationships and emotional safety, whether that be in physical settings or in remote online settings, and also incorporating social emotional core competencies and culturally responsive trauma-informed care practices into instruction, as opposed to at a separate part of the learning day. We also have a second sub-team that is determining social emotional behavior student assessment to help inform small group interventions. We have a third sub-team that is focused on Tier 2 behavior interventions that can be adapted for face-to-face or remote settings. And a fourth sub-team that is designing a professional learning needs survey for staff related to culturally responsive trauma-informed care and LCL competencies that would be used to inform our professional learning design for school year 21. We are also working with community partners to learn from them what they are able to do for us in terms of serving the needs of our students, such as with the Community Mental Health Board, DePaul University, and also Rivers Edge Hospital. You can go to the next slide, please. We also will be assessing our current school meal program, so working with our food services department to sort of assess what's happened during this remote learning phase, and depending on what the calendars look like for the upcoming school year and what the learning models look like, work to ensure that our school meal program is flexible and can really meet the needs of our students and families. Next slide, please. And our team will also be reviewing our procedures around students who are experiencing homelessness to ensure that access to meeting in a physical space with a district office staff person isn't getting in the way or a barrier to accessing any services or needs students who are experiencing homelessness might have. Just in closing, I also wanted to share that we've been soliciting the input from our teachers who currently serve on our PBIS elementary school teams and our middle school culture climate teams to provide feedback on a sub-team area of their choice. And so we're looking forward to engaging them in that process. We have culture, climate, and PBIS planning days with school teams on June 15th and 16th. And at those meetings there, we'll be sharing drafts of this guidance to get feedback from them, but also to discuss ways that they want to engage with their school community to give feedback on plans. And I believe, next slide, and Jim Hackett is up next. Oh, sorry, not quite. No, you can go back to the next slide, last slide, I'm sorry. So they're just kind of some of our key priorities in the next few weeks and next few months. So we're working on getting as much of the sub-team work as we can get done before June 5th, but also seeking out opportunities for those folks who are currently serving on sub-teams to continue work through June. Because we have ambitious plans and realize we may need a little bit more time. And in the next few months, I mentioned like working with our key community partners, and we think that's going to be an ongoing process. Needs will evolve, and we will certainly need community partners who have expertise in mental health to support our work. And also we will, like I said, finalizing our meal delivery program, and certainly needing to get the blessing from our professional learning committee to prioritize social emotional learning and trauma-informed care professional learning for staff. We really, social emotional learning and well-being for students and staff has to be prioritized now more than ever. And we know we'll have to work within sort of the boundaries of the professional learning time we have, but want to advocate strongly for this being a key priority for SY21. Now on to Jim Hackett. Thank you.
Thank you, Carrie. Again, my name is Jim Hackett, and I am the District 97 Safety and Security Manager. My role on this transition team is the facilitator for the Safety Operations and Protocols team. I just want to take just a couple minutes just to talk about the makeup of the team and what we are working on. The SOP team, it's comprised of school and district level administrators, nurses, teachers, administrative assistants, school social workers, school psychologists, and we also have a current Board of Education member who participates in the group discussions. So we took the roadmap presented by Dr. Kelley with the think tank assumptions and recommendations. And as a group, we kind of discussed how to structure our work and what we wanted to do. The route that we chose was to create a set of goals and objectives. We then partitioned the team into an elementary school group and a middle school group. And the reason was so that we can focus on the nuances associated with just each of the buildings. We met in the subcommittees and we continue to work through the objectives. And we're going under a very kind of broad general umbrella at this point. Once we complete that work on the broad objectives, we're going to try and work those into different calendar and attendance scenarios. Our first goal we had was to control access to the school buildings to limit contamination. Now, some of the objectives for this goals, and again, this is just a snapshot of those, it's not all encompassing, is staff, student, and visitor entry procedures, implement weather plans, plans for those students who attend breakfast in our buildings, and then we have to address any modifications to after-school usage. And Michael, I apologize, you can just kind of scroll through some of these assumptions and recommendations. Thank you. The second goal we have is to ensure compliance with CDC, IDPH, and local public health requirements. You know, that's really going to guide us on what we can and cannot do. Some of the objectives for this goal are to define social distance procedures and make any modifications to our schools accordingly. Now, this could be as simple as installing signage related to hand washing. It could be installing demarcations of what 6 feet actually is in the hallways, or it could lead to something more complex, such as setting up temporary classrooms, perhaps in some of our larger spaces that we will not be using for large gatherings. And then we also have procedures for staff and students who are immunocompromised. We have to remember that not everyone reacts the same to the virus, and we have to plan and accommodate those who are at a greater risk of contracting the virus. And then we're also working through modifications to just daily routines, kind of going, what happens on a daily basis? What do we need to kind of address with that? And our third goal is to address student and staff awareness of the symptoms of COVID-19 and establish school level procedures to deal with the illness. So some of the things we're working on there are to identify and develop procedures to mitigate cross-contamination issues for students who have allergies. We're also going to be working on developing a robust training campaign for staff, students, and parents or guardians. And this is a critical objective, and it's going to require pretty deep collaboration with the communications department, our school nurses, as well as other community stakeholders and the community at large. And then we also need to identify a detailed protocol for dealing with student and staff illnesses. So here we are over the next few weeks and the next few months. So over the next few weeks, we're going to work to ensure that we have the supplies we need to maintain a heightened prevention measures and placing those supply orders for all buildings. As Dr. Kelley mentioned earlier, Jeannie Keene has been very proactive in procuring supplies. We have a decent inventory of supplies, but the future is still unknown, so we're going to plan accordingly. We are scheduled to have more supplies arrive in June, including masks and potentially hand sanitizer. But we have to remember that that delivery date hinges on the status of supplies at hospitals. If they're supplied adequately, then we will continue to be in line on our to get our delivery of additional supplies. We will also kind of work through how we screen employees and what procedures they should follow for safety purposes. And this is something that, you know, could require a little bit more collaboration across the community as well. But we will just have to work through that. And then we're going to identify the obstacles to social distancing and establish ways to overcome them. This is a tricky one, as most of them are, but when you're dealing with students, you know, in the elementary school and the middle school, they want to be together. So we have to kind of work on ways to maintain that social distancing. And over the next few months, we will develop school level procedures to limit sharing of high touch items. As mentioned, we'll develop the awareness campaign training modules for staff, students, and parents and guardians. And then we'll work through the safety plan when a staff member, a child, or visitor becomes sick. And I just want to close, as Gina mentioned earlier, a return to full operations is something that requires intense detail and, you know, careful identification of what is needed to facilitate the return. And it requires a strict order in which they should be implemented. And again, in an effort to maintain transparency, we will create timelines and communication plans to support the implementation of the overall plan. And one thing we need to prepare for is the possibility that the virus may return if a vaccine is not widely available. Folks, that's a reality, and we must prepare accordingly. I will now pass it to Dr. Starks Turner for a discussion on financial impact planning.
Thank you so much, Jim, for that introduction. The Financial Impact Planning team is a cross-functional team consisting of myself. We have 2 administrative assistants, a teacher, 2 coordinators, our director of finance, our MTSS director, and 1 board member. As this team has met multiple times, we examine the financial impact of potential reduced funding from the state, federal, and local funding streams. We were pleased to hear today that the General Assembly approved the fiscal year 21 budget, which provided for K-12 funding to be held at the same level as the current budget because of assistance from the federal government. In addition to that, districts will also receive level funding for mandated categorical payments such as transportation, food services, special education services. We will also receive level funding for education, for early childhood education, and an increase in funding for special education reimbursement. So while that was good news to us, we still want to make sure that we plan comprehensively and have a plan B for if for some reason those funds do not become available. As we begin to plan, we also look at alternative funding streams. For example, the CARES Act, which the application became available in ISB. So we are starting to plan for how to spend those funds, and that gives the districts upwards of $320,000, which we do have to give the non-public schools their proportionate share. So we're beginning to plan on how we are going to use those funds. Also, there are FEMA grants available, which we can use to offset some of the costs that we have incurred due to COVID-19. And we are hearing information about other federal funding that is yet to be released. So we will continue to monitor those funding streams. As we look at scenarios for potential reduced funding and how that will impact District 97, we have had a focus on making sure that as best as we can, that our cuts are as far away from the classroom as possible. I've been very impressed with the thinking of the group. It's been lots of out-of-box thinking, an emphasis on working as a team and learning from each other. As we begin our planning to share information with various stakeholder groups, including other employee bargaining groups, we wanted to make sure that our planning is clear, concise, and transparent. So with that said, in the next few weeks, as we continue to monitor the financial impact of this reduced funding, we are looking at food services for families. The current program expires on June 30th, and we are looking at ways to provide food for those families in need throughout the summer. As we look at that, we are looking at potential barriers that are preventing our families access to our food services. For the next few weeks, we will continue to monitor the governor's plan for reopening, and we will also look at identifying employees who serve in different roles who possibly can help support our students and families. We also at the impact that increased families needing financial assistance and what that will look like, families choosing to homeschool their students, put their students in private schools, and what a virtual school district will look at. And then overall considering the increased financial impact of additional expenses due to the pandemic. So still a lot is unknown, and we are planning accordingly as the situation is fluid, and as more information becomes available, we will continue to plan. I can't remember if that was my next slide or if I'm turning it over to Amanda. Okay, turn it over to Amanda. Thank you.
Thank you. So in terms of our next steps, as the team mentioned earlier in the presentation, this planning is obviously going to continue through the summer. And I know they all mentioned as well, a huge component of this work is going to be gathering feedback from our staff, families, and students. So we want to thank you in advance for your support and your partnership in the planning process. And then I also want to say, even though our school year is coming to a close next week, I do want to make sure the community knows that we are going to continue to provide updates via email and through our various channels, the district website, social media. We're on Facebook and Twitter. So please continue to monitor, I would say primarily your email, but also our other channels just for those updates throughout the summer. And then we encourage you to reach out. You know, I know a lot of people have sent emails. You can use Let's Talk, but we definitely welcome the feedback, and we have incorporated a lot of the feedback and questions that we've received into our planning process thus far. So we will continue to do that. And I think that's all I have. So I think I'm turning over to Dr. Kelley now.
Yes, thank you, team. Thank you, everyone.